Hi, I'm doing great. Thanks for asking me to do this. So, I have Muckle Wells, like you just said, and Muckle Wells is one of three variants of umbrella disorder called Cryopyrin-Associated Periodic Syndromes. So, it's a periodic syndrome, which means that the symptoms happen periodically. That's associated with a protein called cryopyrin, and the body overproduces this protein called cryopyrin. There are three variants or three different levels of severity of CAPS. And what I'll do is I'll quickly go through all three of them, but they're on your website, I think. And if not, there's a lot of information available on the internet. So I'm not a physician, so I just don't want to mislead anyone. So I'll just kind of be a little bit cursory with it. A little overview is the least severe one is called familial cold autoinflammatory syndrome. So it's abbreviated with FCAS. And what that is you have autoinflammatory symptoms. So your body experiences inflammation, and it's triggered through exposure to cold temperatures. So people with this variant of CAPS, as long as they're in the cold weather, they're experiencing really debilitating, life-limiting symptoms. So among those symptoms are fevers, headaches, arthritis, a full body rash. It doesn't itch, but you're covered in hives. Um, Red eyes, so bloodshot eyes, constant bloodshot eyes. Some people have nausea and vomiting. Any kind of inflammatory symptom you can imagine could be triggered, and you never know what you're going to get because you never know where the protein's going to store in your body or where it's going to cause these symptoms. There are, most people, everyone experiences the symptoms differently at different times, different severities. So everyone's different, and so it's really hard to diagnose because some people may not get some symptoms and some people may get others, and it's really tricky. But the cold is what triggers it for the least severe form of CAPS. And I say least severe, but it's still an extremely life limiting, debilitating thing to have to suffer through. What I have is middle of the ground, and it's called Muckle Wells Syndrome. So Muckle Wells Syndrome is almost identical, all of the same symptoms, except there's a couple of other little twists to it. One, none of the symptoms are triggered by cold. Cold isn't a factor. The body is just constantly overproducing cryopyrin, or this protein that causes the inflammation. And you just got to deal with it. You got to deal with it, come what may. But the other thing is what differentiates the two, FCAS and Muckle Wells, is the primary differentiation is not just the cold trigger, but also this idea that in me, the protein can build up in an organ. So people with Muckle Wells have a real risk of this protein building up in an organ, causing amyloidosis and leading to organ failure. So organ failure could be treatable. It could be something you catch, but it could also be something that takes you by surprise. And there's a risk of morbidity. So there's a risk without treatment that 1 in 3 people with Muckle Wells could have organ failure that causes them to, causes their death. So that's what puts it higher up on the severity scale. But the most severe is something called neonatal onset multisystem inflammatory disorder. And this is abbreviated again as NOMID. NOMID is the same, trigger. It's this cryopyrin. It builds up, but it starts from birth, and the symptoms are visible right from birth, and they're severe. So the inflammation is already in the joints and in the body. And it's really hard. I don't know that much about NOMID, and the information's online, but what I do know is that children born with NOMID generally present with really, really swollen joints and some other distinctive features. And if untreated, if not detected and not treated really early, there's really bad outcomes for people with NOMID. And in fact, I think morbidity rates are really high. So NOMID is really high on the scale. And as we raise awareness about CAPS, we're really hoping that more physicians can detect these 3 different variants early on to help treat. Because you can live with NOMID, but you have to be diagnosed early and start treatment pretty early. But those are the 3 different forms of cryopyrin-associated periodic syndrome. I'll try to be brief. So I lived my whole life with all of these symptoms of what we now know as Muckle Wells syndrome. So I was always suffering through arthritis as a kid, and I had headaches and red eyes, and there were things I couldn't do because my eyes would be sensitive or my joints would hurt, and that was my life. And I just kind of normalized it. I spent my whole life bouncing around from doctor to doctor to doctor because these symptoms were life debilitating. They're life limiting, like they are for everyone with CAPS. And I never had a diagnosis. I always was given anti-inflammatories and painkillers and things to help ease the symptoms, but no one ever diagnosed me. And then I think everything changed in 2012 because my first daughter was born. And my first daughter she displayed symptoms that I recognized in myself. Kids have rashes when they're young, but my daughter's rash looked just like mine. And I knew that rash was unusual, and I knew that it wasn't going away based on diet or washing the sheets or washing the clothes with different detergent. So I saw my rash in her, and then at one point she experienced the arthritis, and this was in her first year of life. So she couldn't explain at all what was going on, but she stopped walking and whatnot. So when I saw this in my daughter, I made it my mission in life to figure out, I've never been diagnosed. I've just kind of lived through all of these things, but I'm not going to let my daughter, if I can help it, I'm not going to let my daughter live that same limited existence. So I spent for a few months every night just poring over information, going online and reading everything I could find. But I didn't know I was piecing together all the different symptoms. I didn't know they were related. All I was looking for was one symptom at a time, right? I was looking for skin. I was looking for eyes. I was looking for arthritis. I was trying to figure out things about those individual issues that I was experiencing. Needless to say, I started going back to specialists, bouncing around. But this time I went armed with ideas. Whether they were right or wrong, it doesn't matter. I went with ideas, and before I always was just a kind of a passive recipient of medical advice, which is what we're supposed to be because the doctors are the trained professionals. But this time I figured I have to be more active and start challenging those trained professionals and giving them my ideas and letting them know more. And I think that what turned for me was just realizing, I forget what appointment it was and whom it was with, but just realizing that all of the different symptoms mattered. And so I should be telling every physician everything, even if they're not asking. So a lot of physicians you'll go to, say it's a dermatologist, they'll ask about your skin, but they won't be asking about your eyes necessarily or arthritis. And something clicked in me, and I realized that I needed to tell everyone all those things. But when that clicked, I also started researching all those things, and I started looking for links between them. And so I came up with some theories, and I started taking those theories with me to the doctor's office and exploring them. And I spent another, I'd say 7 or 8 months bouncing around from specialist to specialist, which I was used to because my records show when I was a kid, I bounced around to about 200 individual doctor's appointments before I turned 18. And this is appointments. This isn't emergency room visits or anything like that. This is just appointments that I have a record of. And most of those appointments have to do something with the symptoms that I now know are associated with my Muckle Wells Syndrome. Anyways, long story short, what happened was through deduction and just trying everything, I eventually narrowed it down and did more research and more reading online. And I did what a lot of, I think, rare disease patients do or undiagnosed patients do, is that I turned to Google. I started Googling images of people's skin. I put in hives, I put in anything I could do to describe my skin. And I read blog after website. I looked at picture after picture after picture. And finally, I stumbled on something that looked just like me. The skin was my skin, and it was online. And it was kind of, it was a revelation. It was that night where I had a real thing I could start looking at. So I started reading about CAPS, Cryopyrin-Associated Periodic Syndrome. And I think what really changed course in my life was when I realized that this autoinflammatory disorder exists. It's very rare. There's a ton of symptoms associated with it. Anything I had, I could put under this umbrella. But the kicker was when I realized one day that you didn't have to have them all. You could have 2 or 4 or 6 of the symptoms. You could have them some of the time or all of the time or barely any of the time. It was this weird hodgepodge, this weird kind of combinations of different things that could all be associated. And then when you put them all together, it just kind of clicked for me. So there was a night where I was reading medical journals, which I'm not trained. I just had nowhere else to turn. I was just doing everything I could, and I was reading medical journals, and I read something that explained this, this variance of symptoms, and it clicked in me that I need to find a physician who knows about this. And so I went online and I found someone at Sick Kids. I think there were two people in Canada who I could identify through information online who would know something about this disorder, this genetic abnormality. And so I emailed a physician at Sick Kids at 10 o'clock at night one day, and the rest is history. He replied to me and he said, I think you're onto something. Get into Sick Kids, bring your daughter, let's do the testing and see where this leads us. And so uh, my daughter was diagnosed with Muckle Wells Syndrome before her second birthday, which was a huge, huge relief for me, as you can imagine, having lived 32 years before I was diagnosed. So um, pretty awesome, pretty good feeling to get there for her. Is Muckle Wells treated, and is it the same for all variants of CAPS? So Muckle Wells doesn't have a cure, which you've implied with the question. It only has treatment. They have not yet figured out a way to reverse this protein. So you have to treat it by. There's two ways that you can treat it. Two different medicines that are available in Canada. There's a third one in the States. I don't know technically how to explain technically what they do, but I understand they block the protein or they prevent the protein from being released. So I'll go through the two treatments that I know that are available here in Canada. The one that I take is it's an injection. It's a needle every 8 weeks, and it's called Ilaris. The technical name is canakinumab. The needle is subcutaneous, which means it's not in the vein, it's in the muscle, right? And it's every 8 weeks. And we're lucky, the drug company has a service where the nurse actually comes to our home. They do that because the medicine is extremely expensive. I My understanding is, we private coverage, so I don't know the exact costs on a per dose basis. But my understanding is that per person, it's around $16,000 per injection every 8 weeks. So we're very lucky. We're very fortunate to have private coverage. But this drug worked when we first got diagnosed and we first started treatment overnight. I woke up the next day and all of my symptoms were gone. I like to tell the story about how when it happened, I would wake up every morning for, I don't know, say maybe a month or two. And the first thing I would do is look in the mirror because I couldn't believe I wasn't covered in hives or my eyes weren't red. And it took a while to normalize the positives because I'm so used to living through the negatives. And I'm always, you get up in the morning when you have these when you have CAPS, if you're not being treated, every morning you get up and you try to figure out like what it is that you have to deal with today, and then it changes throughout the day. So you're usually prepared for things. So what I mean by that is, uh, I would, to avoid the questions in the summer, if I didn't have hives on my arms in the morning, I would always have a long sleeve shirt with me if I went out for the day or something because I knew I'd have probably hives in the afternoon. And I would just put on a long sleeve shirt and try to stay indoors or something because I didn't want the questions about why are you wearing a long sleeve shirt or why do you have hives or is something wrong with you. So you start your day trying to figure out how to manage your symptoms and manage the social aspects of the disease. That's how I lived through it. So the other treatment is it's a daily injection, which is a lot more work, and I think a lot more people are on this daily injection. It's called, let me just look at it's Kineret or anakinra, and I believe it costs significantly less, but it's still a very expensive drug. It's a needle, mostly self-administered, so most people give themselves a needle every morning or every night, whatever they've scheduled in their day, and it's about $16,000 to $20,000 a year for this daily dose. But again, those are treatments. Those are things you have to be, at this point, taking or doing for the rest of your life if you've been diagnosed with CAPS. If you have Muckle Wells or NOMID, it's a matter of life and death. If you have FCAS, it's a matter of actually living a life that doesn't, get limited by symptoms and pain and just all the other things that you have to deal with socially too. So these treatments are wonderful. They're fairly new. They're available, but they're not cures. Were there challenges getting access to treatment? So I consider myself very lucky. I was diagnosed at Sick Kids, and the team that was helping us knew their way through the ins and outs of coverage. And also, my wife and I had private insurance coverage at the time, so we were very lucky. We didn't have any difficulties accessing treatment. We got our medicine as soon as we could, as soon as all the paperwork was filled out and everything was signed. We're very lucky. But I do think that access is a huge issue for lots of people who have CAPS. And if you have Muckle Wells and you have this risk of morbidity if left untreated, generally speaking, the private insurers are covering it now, and there's an exceptional access program through the province of Ontario. But if you have FCAS where you're triggered by the cold, there's a lot of challenges, I think, for many people accessing this medicine. First of all, if you don't have private insurance, not all of the provinces and territories actually provide coverage for the drug to supplement that possible private insurance. So a lot of people are having to pay out of pocket if they have FCAS in order to get their hands on these daily injections. So I think the access issues really vary depending on where you live, what province, what severity of CAPS you have. The FCAS patients have more difficulty, I think, accessing the medicine, and also whether you have private insurance or not. So I think what we'll have to see in the future is a more concerted effort nationally to make access to medicine unified across the provinces. I think what you don't want to see is people with FCAS having to move across the country to find a jurisdiction where they can actually have access to the medicine that they need in order to live a healthy, productive, normal life. Because I think that you'll find people move where they can get access. But also private insurers, I don't think all of them do, but I think they really do need to pick up this medicine for people who live with FCAS, because I know for me, it was life changing. It's 180 degrees life changing. Like you wake up the next day and everything's gone, and you just feel like you've got a new lease on life. So I think it's really important that we make sure we fight for access for everyone to these medicines. What support systems do people with CAPS need, and what do they actually have access to? This is an excellent question. Like any disease or illness, it varies. Every person needs something different, depending where you live, depending what you're dealing with, depending what symptoms you have, depending who's caring for you or who you're caring for, if you're an adult or a child. So there's really no cut and dry or black and white answer to this question. It's a debilitating, life-altering condition, and some people can power through. I was very lucky. I was able to take Tylenol and Advil and put drops in for my whole life, and just kind of live just limited and always feeling like something was lurking around the corner that I'd have to deal with. But I was able to exist and function. Some people have arthritis so bad they can't function. Some people's eyes are so red and so sore they just can't go out in the sun. It varies depending on where you are and what you have to deal with. I think at the very least, though, the types of services that we need to make sure are available for people with CAPS are community-based services and support services. So what I mean by that is, if you're helping to care for someone with CAPS who's otherwise unable to care for themselves for whatever reason, for whatever condition they have, you need to be able to access community care, so someone who can come and help you care for that person, someone who can come to your home. But I think you also need to be able to access information a lot easier than you can now. CAPS is rare. It's a rare disorder, so there's not a lot of information out there. It's growing, and we're learning more, and we're finding more people with it, and that's good because more information will become available, and more websites will have information about CAPS on them, like yours, which has wonderful resources. So I think that's good. But the biggest thing that's hard to do that we're seeing, there's an organization in the States that's helping this happen, bringing people together. So it's helping you identify other people who are living with the same struggles and the same challenges. So learning about other people and meeting other people who have CAPS and who are dealing with FCAS. Because it's genetic, most of the people you'll meet in your life, genetic and rare, Most of the people you'll meet in your life who have the same condition are your family. So that's good, because generally speaking, you have access to your family and you know how to access them. But it's also good to have outside perspective and outside support. So I think it's important that we build community so that we can share experiences. But the biggest thing I would say that we need to be worried about is access to medicine and access to treatment and access to care. Because CAPS is so rare, you have to live in a major city, generally speaking, to be able to find a physician who's going to diagnose you. If you're not in a major city, you're going to have to travel to one. It's going to be very, very hard to find a physician who knows about this really rare disorder, who isn't working at one of the major hospitals in the major cities or something like that, or isn't world renowned. So that's the trick. Is a lot of people don't live in the metropolis. A lot of people live where they live, and so getting access to care is difficult, and that's why we need to make sure we have lots of information online, lots of resources online, lots of ability to communicate with and contact other people online, because the internet's the great equalizer. It allows us to bridge these big gaps between us and allows us to take all these miles and turn them into clicks and ones and zeros. So services are there. We need them. We need them to grow. We need them to be in the communities. But at the very least, we need to make sure that all of those things are being attended to online as well. So those people who aren't within the big centers can get online and access people and information and know where to go and know how to get support when they need it for what they need it for. But again, everyone's different. So Muckle Wells is estimated to be a 1 in a million disorder. Given that so few people have MWS, is it difficult to get people's attention in order to raise awareness? Uh, Good question. Yes, it's almost impossible. It's there's so few people, and we're not standing in the same place, and we all live all over the country, that you really have to yell loud to get your voice heard. Even if all of us were standing in the same room and yelling, it's really going to be hard to get our voice heard. And that's the same, I think, for any rare disease group, any rare disorder. You want people to know about your condition because you want people to care about it, and you want science and medicine and policymakers to prioritize it, because I want it gone. And everyone with this doesn't want to deal with it. I don't want to take medicine every 8 weeks. I'm happy that I get to eliminate my symptoms by taking this medicine. But I don't want someone to have to pay for my medicine. I don't want to take this medicine. I would love if the science found a way to just flick the switch and turn off CAPS. That would be the ultimate. And I think everyone who has a life debilitating disorder wants that. So raising awareness, it's very hard. But what I've learned since being diagnosed is that people in the rare disease community I've never met a group of people so determined and so motivated and just so energetic. You can find energy when you have none left if you are fighting for awareness and I guess attention for your disorder. And I just find that it's been really neat, the people I've met and the way they've gone about their business. And I mentioned this before, but I think one of the great tools we have available to us is this internet. I think the internet is in many ways kind of a great equalizer. We don't have to wait for a medical journal to pick up information about CAPS and physicians to pick up that medical journal and read it. We don't have to wait for that anymore. I think what's happening is you're seeing people leverage the internet and social media and all of the tools we have available to us to reach out, to find ways. So rare disease patients are creative, and we're finding ways to get ourselves in front of influencers. And the way I think we're doing that is you're seeing more and more advocates that are finding their way into those forums that the influencers themselves frequent. So the internet helps us do that, right? So if I want to get information about CAPS in front of physicians, one of the things that you can do is find where they go and what they consume and what they're reading. Like, we're always consuming information online all day. Every single one of us now not every single one of us, but most people are attached in some way or another throughout the day to the internet. And we don't have to wait, for the newspaper in the morning or wait for the news at night. We're always consuming. So if I, as a rare disease patient trying to raise awareness, can find a way to get my information into the forum that the influencers are consuming, the things that they're reading on a daily basis, the things that are motivating them, then maybe they'll see about it and they'll learn about it, right? So that's the trick. That's, I think, how rare disease patients are finding ways to get the word out, get in front of policymakers, get in front of physicians, get in front of whoever you need to get in front of, but you have to be creative. I don't think a physician is looking up Muckle Wells if there's no reason to do so, if they've never heard about it. I've got to get it in front of them when they don't know they're looking for it, right? So that's the trick. And that's, I think, how we're going to raise awareness for all these little, not little, all these significant but very rare disorders where there's so few people, and even if they all yelled as loud as they could, the voices still aren't that loud collectively. How can organizations like RareShare help rare disease patients and their families? So there are more organizations popping up, and they're disease-specific groups, but there's also more umbrella groups. So in Canada, we have the Canadian Organization for Rare Disorders, and there's also a couple of other groups that have popped up in Canada that are doing big things and raising awareness and trying to unify people and create communities. What I think these organizations need to do is focus on what they're doing and do it well. So I think as long as you don't spread your mandate too thin and you're focused on those 2 or 3 or 4 things that you're trying to do, I think that's the best, most effective thing you can do. Because with rare disease patients, right, there's so few of us. We're spread all over the country. It's hard for us to find ways to collectively speak up and use our voices because we might not ever meet anyone that we may speak to each other online and never ever meet in person, ever. So I think the things that websites like and organizations like RareShare can do is to do what they do and do it well. Create those spaces for the patients to find each other. Make sure there's resources there. Encourage those individuals to engage with each other and create greater community through the space that RareShare is providing. Find a way to get information about medicine and physicians and access and care onto those community spaces so that for example, when I go online, I can communicate and I can connect with other people with CAPS and see what they're going through and see if they have tips that will help me deal with my symptoms and navigate the medical system, the healthcare system. So to that end, we've created a website called Canadian CAPS Network. It's still in the works, but we're trying to build a web space specifically for people in Canada with CAPS, so we can put resources up there. It's still under construction. We've also created a Facebook group that's called the Canadian CAPS Network. So there's a lot of people with CAPS who are on the Facebook group, and there's quite a few of us who are very active, and we share information when things come out in the media, when there's new medical journals. We're sharing it on that Facebook group, and we're hopefully going to be able to do a lot of that on the website as well. The reason I think the website's important is because, not everyone's on Facebook, but everyone can, manage to find access to the internet, generally speaking. So whether it's through a library or community resource or at home, and then if everyone can access the website, then hopefully we can create a community space there too, like RareShare is doing. So, I think the best thing that the RareShares of the world can do is to decide what they want to do and to do it as best as they possibly can so that it's strong, steady, and available and helps those communities form and grow and strengthen. What piece of advice would you offer to people who are living with or know somebody living with CAPS? Well, I think this is a great question. My advice now would be much different than it was, 5 or 10 years ago, because we've come so far. So much has changed. I think if you know someone who you suspect may have CAPS or who does have CAPS, I think the best advice I can give you is to tell them to reach out and connect with others. you can feel alone. You can feel very alone when you suffer through a rare disorder, an undiagnosed disorder, and you don't know anyone who's got what you've got. You don't feel like anyone understands what you're going through. And so, because because of the internet, because of all these tools we have available now, we can create these community spaces, and we can engage with one another. We can share our stories, best practices, things that have worked, things that haven't worked. So I think the best thing you can do, if you know someone who has CAPS and just recently been diagnosed or going through the diagnosis process, tell them to get online and find us and reach out and communicate and share their stories. People with CAPS and people with rare diseases, generally speaking, are open books. We're here to help one another. We know the struggles that everyone else is going through. Everyone has their own little twist to the struggle, but generally speaking, we have information we can share. We have stories. So I think the biggest thing I would say is find support. Now, if you're someone who doesn't know but thinks they might have CAPS, there's an organization in the United States called the Auto-Inflammatory Alliance, and it's run by this amazing woman who dedicates so much time to helping people with autoinflammatory disorders. Karen Durant, she has a full-time job but does this on the side, and she's been putting together a chart, an autoinflammatory disorder chart, and this is a visual chart. So if you go online and you think you might have an autoinflammatory disorder, Google the autoinflammatory disorder chart. It'll come up, and it's got pictures and explanations of all of the different disorders that have now been diagnosed. So you can take this chart with you. You can print it off, you can send it to your physician, and it's amazing because it's such a great tool. So I would say if you're looking for an answer and you have hives and red eyes and arthritis and migraines and fevers, and these are the things that you're experiencing, they come and go find this chart, look it up, take it to your physician, ask them for a referral, see if you can get genetic testing, and then go from there. There's so many of us online that can help and offer our stories and offer our assistance and tell you where we went and who we saw and what we did. So get online, get that chart, take control of your healthcare story. There's a lot of information out there as the gene is mapped, as the human genome is mapped, and as we become more aware of more disorders, and as information is shared more readily online, there's more and more information physicians need to know. So if you are informed as a patient, you can help your physician get you to the place you need to get to. I'm not saying go in there and question everything. I'm saying go in there informed. Do your reading and read as much as you can before you go in there. Work with your physician to get yourself to where you need to get to. And know that there's communities online of people who are here to help you share your story and help you find that comfort in your struggle. So I think that's one of the biggest pieces of advice I would give to people who are struggling to find their diagnosis or struggling to find their community. Get online and connect, because you never know when there's going to be someone 2 streets over from you. It's so rare. Reach out and make a connection with someone online, and then see if you can be a part of our community. Thank you guys for letting me do this for the website. I really appreciate this. I think it's great. The more awareness we raise, the more people will hopefully find their answer and not feel alone and be able to get support and get help. So thank you for asking me to do this.